If you're over 60 and still masturbating the same way you did in your 30s, you could be causing serious damage to your circulation, your prostate, and your nerve function. As a urologist with 25 years of experience, I've seen the consequences of men who never learn to adapt their technique to their aging body. Today, I'm going to explain exactly how to masturbate safely after 60, the 3 critical mistakes that could be harming you right now, and the warning signs that mean you need medical help immediately. I'm Dr. Mei Anderson, a board-certified urologist and men's health specialist. Over the past 25 years, I've treated thousands of men dealing with the complications that come from not understanding how masturbation needs to change as we age. This isn't a topic most doctors discuss openly, but it should be, because masturbation after 60 can either support your health or seriously damage it. And the difference comes down to technique, frequency, and knowing when something's wrong. Let me start with the medical facts. Masturbation doesn't become unhealthy after 60. In fact, regular, gentle self-stimulation supports prostate health, maintains circulation, and helps preserve sexual function. But your approach must change because your body has changed. After 60, several critical systems that affect sexual response undergo significant shifts. Your testosterone levels decline by about 1 to 2% per year after age 30, but this decline accelerates after 60. The blood vessels that supply your penis become less elastic due to changes in collagen and elastin, making erections slower to develop and harder to maintain. Your nerve endings become less sensitive, what neurologists call age-related sensory decline. The nerve conduction velocity slows down, meaning signals take longer to travel from your penis to your brain and back. Most importantly, your recovery time increases dramatically. Your refractory period, the time needed between ejaculations, can extend from minutes in your 20s to days in your 60s and beyond. This isn't a minor change. It's a fundamental shift in how your body processes sexual activity. And when men don't account for this, they end up forcing their bodies to perform in ways they're no longer designed to handle. Here's what most men don't realize. When you don't adapt your masturbation technique to these changes, you can cause lasting damage that affects both solo and partnered sexual experiences. I'm going to walk you through the 3 most dangerous mistakes I see men over 60 make when masturbating. Mistakes that can lead to nerve damage, prostate inflammation, and circulation problems. Then I'll give you my step-by-step protocol for safe masturbation after 60, including specific positioning recommendations and product suggestions. Finally, I'll cover the specific warning signs that require immediate medical attention, and how to have that potentially awkward conversation with your doctor. This information could prevent you from developing conditions that are difficult and sometimes impossible to reverse. The first and most damaging mistake is using excessive pressure and grip strength. When men notice decreased sensitivity as they age, the instinct is to grip harder and apply more pressure. This is exactly the wrong approach and can cause permanent damage. From a urological perspective, the penis contains delicate erectile tissue called the corpus cavernosum, spongy chambers that fill with blood during arousal. This tissue is surrounded by sensitive nerve pathways and tiny blood vessels called capillaries. When you apply excessive pressure during masturbation, you compress these structures and can cause lasting damage. Over time, this compression can cause what we call pressure-induced neuropathy, essentially nerve damage from repeated trauma. I've treated men who developed permanent numbness in areas of their penis because they consistently used too much pressure during masturbation over years or decades. The damage is gradual, which makes it insidious. You don't notice it happening until one day you realize you can barely feel anything at all. Excessive grip can also damage the small blood vessels that supply the penis, leading to reduced circulation and difficulty achieving erections even during partnered sex. This creates a vicious cycle where decreased sensitivity leads to more pressure, which causes more damage and even less sensitivity. Let me tell you about William, 68 years old. He came to my office complaining of numbness in his penis that had progressively worsened over 3 years. During our consultation, he admitted something that many men are too embarrassed to share. He said he could only reach orgasm with an extremely tight grip, so tight it would be painful with a partner. This was a clear sign of nerve damage from years of excessive pressure. William had no idea he was harming himself. He thought he was just adapting to getting older. He told me, "Doctor, I figured if I couldn't feel much, I just needed to work harder." But that's like trying to hear better by shouting into your own ears. You're not solving the problem. You're making it worse. The medical solution is what I call pressure titration. Start with the lightest touch that produces any sensation at all. If you can't feel light pressure, the issue isn't that you need more force. It's that your nervous system needs more time to respond. Allow 60 to 90 seconds for nerve pathways to activate before gradually increasing pressure. This waiting period is critical because your nerve conduction velocity has slowed. The signals are still traveling, they just need more time to complete the circuit. Never grip so tightly that you're compressing the shaft completely. Think of it as gentle massage, not mechanical manipulation. Your goal is stimulation, not domination. And here's something most men don't consider. The amount of pressure you use trains your nervous system. If you consistently use high pressure, your brain recalibrates what's normal, and anything less than that pressure stops working. You're essentially creating a tolerance, similar to how drug tolerance works. The more you use, the more you need. If you're finding this helpful so far, make sure you subscribe to Vital Health Seniors. My next video will reveal the 3 biggest erection killers that have nothing to do with testosterone, and you don't want to miss it. Now, let's talk about the second critical mistake I see men over 60 making. The second critical mistake is masturbating too frequently for your age-related recovery capacity. Many men continue daily, or even multiple daily masturbation patterns from their younger years, not understanding the physiological changes that make this harmful after 60. Here's the urological science. Your prostate produces about 30% of your seminal fluid, including important enzymes and proteins. After 60, your prostate needs significantly more time to replenish these secretions. When you masturbate too frequently, you're essentially forcing your prostate to work overtime, which can lead to inflammation, discomfort, and potentially contribute to benign prostate enlargement. Additionally, your hormone cycles change dramatically after 60. Frequent ejaculation can disrupt your natural testosterone rhythms, leading to fatigue, mood changes, and decreased libido over time. Your luteinizing hormone and follicle-stimulating hormone levels also become more sensitive to disruption. These aren't just abstract hormones. They control your energy levels, your motivation, your sense of vitality. When you disrupt them with excessive frequency, you feel it in every aspect of your life. I've seen men who masturbate daily after 60 develop what I call ejaculatory fatigue syndrome, where each subsequent orgasm becomes less satisfying, takes longer to achieve, and leaves them feeling drained rather than satisfied. They describe it as feeling hollow, like they went through the motions but didn't get the reward. That's your body telling you it needs more recovery time. From my clinical experience, the optimal frequency for most men over 60 is every 48 to 72 hours. This allows your prostate time to recover, your hormone levels to normalize, and your nervous system to reset. Some men find that spacing it out even more, say twice per week, provides the most satisfying experiences. And here's what's fascinating. When men make this adjustment, they often tell me the quality of their orgasms improves dramatically. They're not just more intense, they're more fulfilling. When I explained this to William during his follow-up visit, he was skeptical. He'd been masturbating almost daily for decades. He said, "You want me to wait 3 days? I'll go crazy." But I told him to try it as an experiment. Just 3 weeks. Within 2 weeks, he reported something surprising. Not only did the numbness stop progressing, but his orgasms felt more intense. He had more energy throughout the day. His mood improved. He told me, "I didn't realize how tired I was until I stopped being tired." I've had patients who reduced their masturbation frequency and found their experiences became significantly more pleasurable and satisfying. They reported stronger orgasms, better energy levels, and improved mood. This isn't about deprivation. It's about working with your body's natural rhythms instead of against them. Quality over quantity becomes increasingly important as we age. You wouldn't eat 5 mediocre meals when you could have 2 excellent ones. The same principle applies here. The third mistake is attempting masturbation without proper lubrication. Many men think lubrication is only necessary for vaginal intercourse, but this is medically incorrect, especially after 60. As testosterone levels decline, your body produces less natural lubrication during arousal. The pre-ejaculatory fluid that once provided some natural lubrication becomes scanty, or may disappear entirely. Simultaneously, the skin of the penis becomes thinner and more susceptible to microtrauma. This is due to changes in skin elasticity and collagen production that happen as you age. Your skin simply doesn't bounce back the way it used to. Dry masturbation creates friction that can cause microscopic tears in the skin. Tears so small you can't see them, but large enough for bacteria to enter. These microtears serve as entry points for bacteria, potentially leading to infections, inflammation, or conditions like balanitis, inflammation of the head of the penis. I've treated numerous men over 60 who developed recurrent infections because they never used lubrication during masturbation. Some developed chronic inflammation that made any sexual activity painful. Even more concerning, repeated dry friction can lead to scarring of the penile skin, which reduces sensitivity permanently. I've seen men who developed what's essentially scar tissue around the head of the penis from years of dry masturbation. Once that scar tissue forms, it's extremely difficult to reverse. You're trading temporary convenience for permanent loss of sensation. Remember William? When I examined him, I found not just nerve damage from excessive pressure, but also subtle scarring from years of dry friction. He'd been compounding his problems without realizing it. Two major mistakes working together to steal his sexual function. He told me later, "If I'd known 20 years ago what you're telling me now, I could have avoided all of this." That's why I'm sharing this information with you today. Prevention is always easier than treatment. From a urological standpoint, the solution is straightforward. Always use a high-quality, unscented, water-based lubricant before beginning any self-stimulation. Apply it early in the process, not as an afterthought when friction becomes uncomfortable. By the time friction feels uncomfortable, you've already caused some degree of microtrauma. You want to prevent that damage, not react to it. Avoid products with glycols, parabens, or artificial fragrances, as these can cause irritation in sensitive aging skin. Your skin becomes more reactive with age, and chemicals that didn't bother you at 40 might cause problems at 65. Also avoid oil-based lubricants if you use condoms with partners, as oil can break down latex and compromise protection. Some specific products I recommend to my patients include brands like Good Clean Love, Aloe Cadabra, or simple drugstore options like KY Naturals. The small investment in proper lubrication can prevent significant medical problems down the road. We're talking about spending maybe $10 a month to protect one of the most important aspects of your health and quality of life. That's not an expense. That's insurance. Now let me give you my complete protocol for safe masturbation after 60, what I call the CARE method, with specific positioning and technique recommendations. C stands for cleanliness and comfort. Always wash your hands thoroughly before beginning. This isn't being overly cautious. Your hands carry bacteria from everything you've touched throughout the day. Doorknobs, your phone, money. You don't want any of that near the sensitive tissue we've been discussing. Ensure your environment is clean, private, and comfortable. This isn't just about hygiene. It signals to your nervous system that it's safe to relax. Your nervous system can't fully engage in arousal if part of your brain is worried about being interrupted or uncomfortable. Consider your position carefully. Avoid sitting on hard surfaces that can compress nerves in your perineum, the area between your scrotum and anus. This area contains important nerves that supply your penis, and compressing them can interfere with sensation and erectile function. A reclining position, or lying on your side, often works best. These positions allow for good circulation, and don't put pressure on any critical nerve pathways. A stands for appropriate technique. Apply lubricant first. This is non-negotiable after 60. I tell my patients to apply lubricant before they're even fully aroused. That way, every moment of the experience is protected. Start with light pressure and slow movements. Use your entire hand, not just fingers, to distribute pressure evenly. This prevents any one area from bearing too much force. Allow your arousal to build gradually rather than forcing it. This is important. Your nervous system needs time to ramp up at this age. Think of it like warming up before exercise. You wouldn't go from sitting on the couch to sprinting. You need to let your body adjust. If your grip tightens unconsciously, pause and reset. This happens more often than you'd think. Men get caught up in the moment and revert to old patterns without realizing it. Check in with yourself every minute or so. Consider alternating hands or changing your grip position every few minutes to avoid repetitive strain on any one area. This distributes the workload and prevents any single nerve pathway from being overstimulated. Some men find that using a sleeve or textured device designed for men can provide stimulation without requiring a tight grip. These devices can be particularly helpful for men who've already developed some degree of reduced sensitivity. R stands for respect timing and recovery. Allow 15 to 20 minutes minimum for the full experience. This isn't wasted time. This is allowing your body to fully engage its arousal response. Don't rush toward orgasm. The journey is just as important as the destination, especially after 60 when the quality of the experience matters more than the frequency. Let arousal build naturally, fade, and return. This wave-like pattern is normal, and often more satisfying than a direct approach. It's called edging in some circles, but from a medical standpoint, it's simply allowing your body's natural arousal cycle to complete. Your nervous system works in waves, not straight lines. Follow the 48 to 72 hour recovery rule between sessions. Mark it on your calendar if you need to. Consistency matters more than you think. E stands for evaluate constantly. Pay attention to your body's signals during and after masturbation. Any unusual pain, changes in sensation, or unexpected responses deserve medical attention. Your body communicates through symptoms. Listen to it. This is where it gets interesting. After I taught William the CARE method, everything changed. He started using water-based lubricant every single time. He reduced his frequency to twice weekly, spacing sessions about 3 to 4 days apart. He focused on lighter pressure and spent more time on the experience rather than rushing to completion. He set a timer for 20 minutes and refused to finish before it went off. That discipline was hard at first, but it retrained his body. 8 weeks later, he came back to my office with a smile I'll never forget. He said the numbness had improved by about 60%. His orgasms were stronger than they'd been in 5 years. And for the first time in a long time, he felt confident about his sexual function again. But what really got me was what he said next. He told me, "My wife noticed something was different. She said I seemed happier, more present. She didn't know what I'd changed, but she could tell something had shifted." That's the ripple effect of taking care of this aspect of your health. It doesn't stay isolated. It affects your mood, your energy, your relationships. After 60, it's not about performance. It's about preservation. Speaking of medical attention, here are the specific warning signs that require immediate evaluation by a urologist. First, any pain during or after masturbation that lasts more than 30 minutes, especially if it's sharp, burning, or worsening over time. Pain is your body's alarm system. Don't ignore it. Second, sudden changes in sensation. New numbness, burning, or tingling that doesn't resolve within a few hours. This could indicate nerve compression or damage. The sooner you address nerve issues, the better your chances of recovery. Nerves can heal, but they need intervention quickly. Third, visible changes. Swelling, discoloration, unusual bumps, or any discharge that persists beyond 24 hours. Pay particular attention to any discharge that's yellow, green, or has an unusual odor. These are signs of infection that need treatment. Don't wait for it to get better on its own. Infections in this area can spread and become serious. Fourth, urinary symptoms. Difficulty starting or stopping urination, changes in flow strength, pain during urination, or increased frequency that coincides with masturbation. Your urinary system and sexual system are interconnected. Problems in one often affect the other. Fifth, any bleeding, no matter how minor it seems. This could indicate skin tears, irritation, or more serious underlying conditions. Blood should never be part of the equation. If you see it, get it checked. And sixth, persistent changes in erectile function. If you notice that you can no longer achieve erections during masturbation when you previously could, this may indicate circulation problems that need evaluation. Erectile function is often the first sign of cardiovascular issues. Cardiologists call it the canary in the coal mine. Your penis requires good blood flow. If it's not getting it, neither is your heart. Don't hesitate to contact a urologist about these concerns. We've seen it all, and early intervention prevents minor issues from becoming major problems. I've had men tell me they waited 2 years to come in because they were embarrassed. By that time, the damage was much harder to reverse. Your urologist is not there to judge you. We're there to help you maintain function and quality of life. Let me tell you about another patient, Henry, 74 years old. He came to me embarrassed and frustrated. He'd been dealing with nightly urination, low energy, and intimacy struggles. His wife had stopped initiating because she could sense his anxiety about performance. I recommended he add zinc-rich pumpkin seeds to his diet to support prostate health and testosterone production. I also told him to reduce his masturbation frequency to twice weekly, and always use lubrication. Within a few weeks, not only did his bathroom trips reduce from 4 times a night to once, but he told me something that brought tears to his eyes. He said, "Doc, I feel like I got my spark back." His energy returned. He started working in his garden again, something he'd given up because he was too tired. His relationship with his wife improved because he wasn't exhausted and irritable all the time. They were laughing together again, holding hands while watching TV. That's the power of supporting your body at the cellular level. Small changes, massive ripple effects. Masturbation after 60 can be a healthy part of your self-care routine when done correctly. It supports prostate health by regularly clearing out old fluids and promoting circulation to the gland. It maintains circulation throughout your pelvic region, which supports erectile function. It reduces stress by releasing endorphins and promoting parasympathetic nervous system activity. And it helps preserve sexual function by keeping the machinery running, so to speak. But it requires adapting your technique to match your body's changing needs. Remember the key principles. Slower, gentler, less frequent, and always with proper lubrication. Your body has earned your respect and care. This isn't about performance or proving anything. It's about maintaining your health and staying connected to your body in a positive way. Your refractory period went from minutes to days. Your technique needs to match. That's not a limitation. It's just a different operating system that requires a different approach. If you want to avoid the nerve damage, infections, and circulation problems I've described today, subscribe to Vital Health Seniors right now. This channel is dedicated to evidence-based men's health information that can prevent you from suffering in silence. Your sexual health is an important part of your overall health, and addressing issues early prevents more serious problems later. I release videos every week covering topics that mainstream medicine often ignores or dismisses, the practical information men actually need to maintain their vitality. And here's what I need you to do next. I know this is sensitive. You probably won't share this publicly, I get it. But if you have one close friend you trust, maybe text him privately. This doctor explains something important. That's it. You might save him from permanent damage. Maybe it's a friend who's mentioned being tired all the time. Maybe it's a brother who's become withdrawn. Maybe it's someone at church who looks like he's lost his spark. Hit that like button and send this to him. You might be the reason he avoids permanent damage. You might be the reason his relationship improves. That 5-second action could change someone's life. In my next video, I'm revealing the 3 biggest erection killers that have nothing to do with testosterone, and they're hiding in plain sight. One of them is probably in your kitchen right now. Another is something your doctor might have recommended for your heart health, but it's destroying your circulation where it matters most. You don't want to miss it, because even the care method can't help if these killers are in your daily routine. Make sure you're subscribed and turn on notifications so you catch that video when it drops. Take care of yourself. You deserve to age with confidence, comfort, and dignity. I'm Dr. Mei Anderson, and I'll see you in the next video.